Good afternoon and good afternoon. Well, welcome to the Taj Talk live stream on YouTube channel. I am so excited today. I have with me today Miss Kate Brown and Miss Sarah Doughty, and we're going to have a candid conversation on cervical cancer screening. So look, tell everybody we're on the air, share the link, get people on because we want them to hear this. Remember, share the link. We want people on this screening. Well, Sarah, how are you today?
I'm doing great. How are you?
Are you excited?
I'm very excited. I'm glad to be here and appreciate Taj Talk letting us come and talk about the importance of cervical cancer. So I'll introduce myself. I'm Sarah Doughty. I'm with the UNC Gilling School of Global Public Health, Department of Epidemiology, and I work on the My Body, My Test project. And we'll talk a little bit more about that today, but it's to provide access for women in Wake County and across North Carolina, free cervical cancer screening. So, and then we'll let Kate introduce herself.
Yes. And hi, I'm Kate Brown. I'm a 2-year cervical cancer survivor, a cervical cancer and HPV advocate.
Awesome, awesome. So
yeah, today, we're here to talk about a really important, women's health topic, cervical cancer. We want to help reduce the stigma around cervical cancer and HPV infection and talk about why it's so important to get regularly screened for cervical cancer and to let you know about this My Body, My Test opportunity. So we'll talk about that a little bit later. And Kate, as a cervical cancer survivor, yes, it's really important, I think, for women to hear your story. So we would love for you to share your experience with finding out about it and just take us through, that story and your experience.
Absolutely, Sarah. Thank you so much for having me on today. So my story actually begins in late 2015, and I had just started a new job, and I started having abnormal gynecological symptoms. And as a working mom, very busy, I was oblivious to it. I had just started working with a large group of women. I thought our cycles were syncing up, and I thought that is what caused these abnormalities. In end of December 2015, I was on vacation, and I had some symptoms that I couldn't ignore anymore. And we got back to Raleigh-Durham area, and I went to call my OBGYN that I had used when I had my son. They told me, even with my symptoms, it would be 2 weeks before they could get my files off of their site.
Right.
So that was not going to work for me. I went and Googled for other doctors in my area, and when I found one, I called, told their receptionist my symptoms, and within 3 days, I was in and getting checked. I went into the office that day, and the doctor really spoke with me, and he told me, we're going to do a whole body. Let's just see what's going on here. They started with a mammogram, and then he told me that I'm going to do a pelvic exam. We were having a conversation, and during my pelvic exam, and the whole mood in the room changed, and it got very silent. I was asked that dreaded question where I didn't want to answer, and it was, when was the last time you had a pap test? And it had been, at that point, 7 years, for many, many reasons. And he looks at his nurse and tells her, I'm going to need a larger speculum, and I'm going to need a biopsy kit. And when he went and came around and looked at my eyes, he told me, there is a large growth on your cervix, and I am 99.99% sure it is cervical cancer. We did a biopsy, and I received my diagnosis. Several days later, they expedited the pathology test on that, and I was diagnosed with invasive non-differentiated squamous cell carcinoma caused by HPV. And it wasn't the cancer diagnosis that was very shocking. It was the fact that it was caused by HPV. and I wasn't even aware that I had a high risk. Lean back on my friends and my dear husband and my children. My friends actually named my tumor. We named him Timmy. So it was throughout the whole entire fight. It was death to Timmy. And I was very blessed with an amazing radiology oncologist, an amazing gynecological oncologist. I went through 25 external radiations, 5 internal, and 5 chemotherapies. And I got very, very sick, and I was just very blessed to have the family support and my medical support. It wasn't until my last brachytherapy, when I actually was laying there, about to go back into the room, and I said to myself, how could this have been avoided?
Right.
And that was at that point I decided to really boost up my advocacy, because no woman, especially with cervical cancer that is caused by HPV, should have to go through this. In that amount of time, I unfortunately have lost several women that I have gotten to know through my survivor groups. And it's time to end this. It's time for women to have the access to the testing, and which is why I love being part of helping you spread this word.
Well, we do appreciate you, sharing this very important story with other women, and we're glad that you are still here.
Thank you.
And you're able to advocate for this. You mentioned your advocacy work.
Yes.
You want to speak about those 2 organizations that you work with?
Absolutely. I am involved in 2 fantastic organizations. The first one I became involved with is Survivor, and that is spelled Cervivor, and you can find them at survivor.org. It was a fantastic community when I was going through all of my treatments, and they helped me keep going. It's a great survivor advocacy or cervical cancer advocacy group, and I actually attended one of their survivor schools, and now I am a survivor ambassador. And then I'm also with the National Cervical Cancer Coalition here in the RDU area. And again, my focus is underserved women, especially in Wake County, who do not have access to cervical cancer screenings, insurance, and getting the word out there, and hopefully being able to help those women achieve, cervical cancer and HPV screenings.
That's great.
That is great. So now, Kate, you mentioned your symptoms.
Yes.
Can you share with us what you was actually going through so that the viewers can relate, or at least share with someone else?
Absolutely, yeah. My symptoms at a later time I had figured out were completely normal cervical cancer symptoms. I was having painful intercourse. I was having abnormal bleeding, and it would last like a period, and then it would go away for 2 or 3 days. And then I would have another very heavy period, and that would go away. So that kept rotating from September 2015 to December 2015. In December 2015 is when I really, something's very wrong here. And I started having a very watery, clear discharge to the point where it was actually soaking through pads hourly. My husband and my sons and I were down in Alabama visiting family, and I remember having these symptoms and being so embarrassed because I did not want to admit to myself that something was wrong. And I can remember laying out by the pool. It was 10 o'clock at night, looking up at the stars and hearing the ocean and crying, because at that point I knew something was wrong. We went to Atlanta a couple days later, and we were going to the Atlanta Aquarium, and all of a sudden I just had this pain in my woman areas, and went to the restroom, and I had a clot the size of a softball that had passed. And then I started bleeding very heavily. Again, I was embarrassed. I didn't want to worry my husband or my children, So I actually kept that mainly to myself. I called my mom, started crying on the phone with my mom in a bathroom in the middle of Atlanta. But once I called the OBGYN I ended up having my pelvic exam with, and I explained those symptoms to him, that is what made him almost so sure that I had a cervical cancer tumor and not a fibroid.
Right.
Okay, great.
Because those symptoms, all of them combined, what I was telling him,
Right.
were very classic cervical cancers.
And it's a good thing that you just brought the point about fibroids because they mimic each other.
They do.
Because I've kind of been there with the fibroids.
Right.
So you're telling the story, and I'm going, huh?
Yes.
You know, okay, because a lot of times we are misdiagnosed or we think we got it. You know, we
Right.
got it. We're diagnosing ourselves because those symptoms mirror.
They do.
Fibroids, especially with African American women, is really high with us. And I have many women who tell me, you know, I'm having heavy periods, and then we're told, you know, sometimes to get on birth control or different things. So now this brings a whole different awareness to say, hey, wait a minute, you know, just check me for this too.
Right.
Because probably you have fibroids. But along with this, because they mimic each other, give me the extra test, which when I had my fibroids, and I thought about this after we had our conversation, I could remember my doctor saying, I still want a PAP. Jean, you still
Exactly.
need to get a PAP.
Right.
After,
Right.
so I was like, I know my doctor's a little thorough. So she did not do it, and she did. She was like, I still want you to have a PAP. So I had to come back and get that,
Yeah.
and that canceled out the cervical part,
Correct.
That's good.
cervical
Right.
cancer. Yes.
So we should maybe talk about like what is a pap test, you know, what happens during a pap test, you know, and so it looks for abnormal, unhealthy cells that are on the cervix that might turn into cancer.
Correct.
And typically abnormal cells on the cervix will appear long before, you know, you might have cervical cancer. So, which is why it's so important to get screened
Exactly.
regularly. And we can talk about that as well. And you mentioned HPV, human papillomavirus,
Yes.
right? If you want to talk a little bit about what you know about HPV. and-
Absolutely.
yeah.
So HPV, again, the human papillomavirus, is incredibly common, and people often don't realize how
Right.
common it is. There are over 150 strains of this virus, and there are high risk and low risk strains. And high risk are the ones that cause the cervical cancer, and they can cause other cancers as well. But it's very important that women do get tested, which is why when my doctor said to me, when was the last time you had a pap test? I was embarrassed because I know I needed it, but we didn't have insurance and we couldn't afford to go
Right.
to the doctor. And so when he did my biopsy, he did an HPV test
Okay.
as well. And I still get one every 6 months.
You do. Okay.
And that's just typical post-treatment checkups. But it is a very common virus. And unfortunately, there is still such a stigma around it because it is a sexually transmitted infection.
Right.
It's very different, though, and people really need to be educated that it's not just intercourse that spreads it.
Right.
It's skin-to-skin contact.
Right.
Okay.
So, and that is something that a lot of people are shocked when they find out, is that it's not just intercourse, it is
Right.
skin-to-skin contact. So you could essentially get HPV and not have
Right.
intercourse.
Right.
That's a great point. That's a great point because we stick with what we think we know,
Exactly.
and we miss the other part of it, which perhaps could be how the person got it, but the stigma
Exactly.
Right.
of having to say this is what I have keep people ashamed.
Yeah.
Exactly. And I have found that in my 2 years post-treatment, and even when I was diagnosed, there were friends and even family members who were still so miseducated about what that actually meant. And they stigmatized me, and I actually had several friends tell me, well, you must have been so promiscuous. And I felt shame for, I know, right? Like it's their problem.
Okay.
But I felt so shamed until I had a very great talk with my gynecological oncologist. And she said, you could have gotten this, and this is the tricky part of this virus.
Right.
you could have developed this or contracted this virus 10, 15 years ago.
Right.
And this virus can stay dormant for so long in your system.
That's right. Yeah.
So that is one thing that I would like to change about that stigma. You know, the HPV virus can stay dormant.
Right.
And it only takes something to wake it up,
Right.
and then that's when it starts causing. That's why, you know, we have guidelines for Pap test and HPV testing.
Right. And so, you know, we know regular screening prevents cervical cancer.
Yes.
So that's why it's so important to get screened regularly, and we'll talk about that starting, you know, at age 21.
Yeah, I'm so
What?
sorry.
No, go ahead.
We actually joke in advocacy that the best gift you can give your daughter when she turns 21 is signing her up to have her first Pap and HPV test.
Right.
That it gives her a great foundation to go every 3 years or so from there.
Right. So it could be every 3 to 5 years, depending on, you know, what your healthcare provider chooses to do in terms of just a Pap test or a Pap test and an HPV test, which
Correct.
is what they call co-testing. And so, you know, just talk to your doctor about that. So every 3 to 5 years is the recommendation. But many women still think, I remember, you know, years ago, you went every year to get your Pap test.
You sure did. Yeah.
And so many women still think that that's the recommendation, but actually those guidelines have changed,
Yes.
and you don't need to go every year
Correct.
anymore. So a lot of women think, oh, I haven't been in a year, I need to go. And I mean, that's really only if you have a history of having abnormal Paps, right?
Correct.
And so, but that's the conversation that you have with your provider. You know, they are going to let you know when you need to come back and have another Pap test. So for healthy women, we'll say every 3 to 5 years.
Correct. Yep.
So yeah, and we know that screening is effective. You know, cervical cancer does typically develop slowly. Unfortunately, there are some women where it develops very quickly, you know, which is why, you know, you still have to get screened. And a lot of times, though, if you have a positive, you know, or abnormal Pap or a positive HPV, you know, treatment is available, you know.
Correct.
You typically, you know, can prevent it from becoming invasive cervical cancer.
Yes.
Right.
So that's important, you know, to find out sooner rather than later.
Exactly.
You know,
Early detection is
and
definitely
you know
key.
that, yeah. You know, many times doctors can do a simple treatment in their office. You know, if there's an abnormal Pap or a positive HPV result from your co-test. But Kate, I want to go back to something that you talked about. You said it had been 7 years.
Yes.
So, do you mind telling us why you went 7 years?
You know, as a wife and a mom, we at one point in time, it just wasn't available to us. We were not able to afford insurance through either my job or my husband's job. And being a mom, you always put your children first. You put your
That's
family first. As a woman,
Yeah.
you put everybody else
you do.
first.
Typically.
Exactly. And so while I always made sure my sons had their dentist appointments, their vaccinations, their doctor's appointments, and made sure that they were taken care of, I dismissed anything that I needed.
Okay.
I dismissed my health for so long until the point where I was very lucky that I'm very fortunate, very blessed that my husband had insurance through his job when these symptoms were no longer able to be ignored.
Okay.
And there are still times 2 years post treatment where I sit there sometimes and think to myself, what if we did not have this insurance at that time? What if I had let it go and simply kept dismissing these symptoms? What if I just chalked it up and kept going like I often did? And you know, what it, all the
Right,
what ifs
right,
that they
right.
tell you not to think about, but they still come up in your mind.
Yeah. Well, and so you know, you bring up a good point, not having insurance. We know there are still many women who don't have health insurance. It's too
Yes,
expensive,
yes.
or their job doesn't
Right.
offer it. You know, maybe they're not, and they they can't afford to pay for it on their own, or they might be lower income, and so getting to the doctor can be problematic.
Correct.
And paying for that exam, I don't know what it costs for someone who's uninsured, but and so that's a barrier to women getting their Pap test, and we know actually that women who are uninsured don't have that access. They are actually under screened, so they're not getting screened regularly. And those women who are not getting screened regularly are more at risk of getting cervical cancer.
Absolutely. And Sarah, you had mentioned a cervical screening opportunity here in Wake County.
Right.
Can you tell us a little bit more about that?
Absolutely. So, I'm really excited to share about the My Body, My Test project. It is a study based out of UNC Chapel Hill, and I work on that project, and our goal really is to empower women to take control of their health, right? So women's health, it's very important, and so let's talk a little bit about like what My Body, My Test is. We're really here to help women get free cervical cancer screening for those who need it and who qualify for My Body, My Test. So, and we're offering this free screening with a partnership with a community clinic down on Rock Quarry Road. It's called Advanced Community Health. It used to be called Wake Health Services.
Yes.
So they're all around Wake County, actually. They have different sites in Wake County, and we're working with the one on Rock Quarry Road. But for women who are overdue, they haven't been screened, they haven't had their Pap test in a long time, these women are most at risk. And we are trying to save women's lives by getting them this life-saving screening. It's free screening to them, while they participate in the My Body, My Test project. So they'll, and if they choose, nobody has to. They can still sign up and participate in the study. But they don't have to get the Pap test if they don't want to, but it's offered to them. It's offered to everybody in the study.
So now you mentioned a study along with the screening.
Right.
So what is the study going to bring about? Are we looking for the answers, or?
So we're looking, that's a good question. Thanks, Jean. We're actually looking at ways to make it easier for women to get cervical cancer screening. And so some women in the group will get to try a self-test at home, but everybody gets offered this free screening, and so we help schedule a free Pap test with them with Advanced Community Health. So women who don't have insurance have trouble paying for health care services. They have a harder time getting this Pap test, and so that's what this study is for. That's what this My Body, My Test project is for. I obviously, other groups of women who are also at higher risk are Latinas and Black women, unfortunately. They have higher rates of cervical cancer compared to other groups of women. And I do want to recognize, though, that, research and, previous the history
exactly
the Black community, there tends to be fear and mistrust of doctors, right? Because of this history of mistreatment.
It goes deep. It's generational,
right?
I would say that we're in a time now where we're a little bit more open to it, because we now understand we need answers, we need solutions, we need cures, and so we're the Black community is more open to it. But yes, the history has been a stigma, so that when we find ourselves at this conversation or at this place, the answers or the cures are not there readily based sometimes on ethnic groups, because there are differences in the ethnic group of how our bodies do. Like I say, with fibroids, African American women are really high for that. So we understand that. So trying to get past that, which can be taboo in the Black community, and really opening up and bringing this knowledge. That's why this conversation is so important about this subject, about cervical cancer, because we don't talk enough about it. I think across the board with everybody,
and I think,
we don't talk that enough.
I'm so sorry, Jean. I think that also has to do with a lack of access to education and knowledge about issues such as cervical cancer and HPV. testing in those lower SCS or socioeconomic communities. And it really affects the women because the women are the ones who are constantly going. They're the moms, they're the wives, and they're working, and women, we're tough.
Yeah.
So we really don't want anything slowing us down.
We're tough until we can't be tough anymore.
Exactly.
You were at a point that you were tough until you couldn't be tough anymore, and your body says, "I'm now going to take over."
Right.
And you pushed it, and of course, like we're having this conversation, to just make people knowledgeable. You know, we say that knowledge is power, but actually applied knowledge is power. Right. So once you get this knowledge and you apply it and you put it into motion, just getting the information to the community is in part why I'm with part of this here. I'm like, look, I get it.
Right.
I get it. I own a salon. I get the women here. I get to talk to them about stuff. This private little area is like their sanctuary. And to just talk to them and say, hey, look, get rid of the stigmas. Get yourself checked.
Right.
Get yourself checked. We all know about the PAP, the dreaded PAP. Yes, we know about it. But
It's so glamorous.
in the Black community, there are those ladies who are underserved, underinsured, and at times it's been me.
Yeah.
So you can't even really tell the face of the woman.
No,
Right.
You can't.
You can't look at her and say, you look like, because you just never know with the climate of like jobs and switching. But just to get it out there and offer this in my body, my test project, I think is a really good start.
Yeah.
And partnership with the community to say, hey, look, there's somewhere you can go. Come, we're here for you.
Right.
So I'm excited about the initiative.
Yeah, we are too, and we've been working really hard to spread the word about it in Wake County and let women know there's this opportunity. So just, this is an effort by women for women, and so
Which is so important.
it is. Yeah, we're, we have enough men in our lives telling us, what to do with our bodies.
True.
And so this, my team is pretty much all women, and so we're excited to be here and talk about my body, my test. So there's for women who, are interested, they want to know if they're eligible to participate. There's a hotline.
Oh, great.
So the hotline is, it's 1-877 My Test 1. And the numbers for that are 877-698-3781. So that's 877 My Test 1. And so we have team members ready to take your call.
That's good. Yes.
You can call the hotline. And they're going to ask you a few questions to see if you're eligible. So women who are between 25 and 64, if you're uninsured, or even if you have Medicaid, and it's been a few years since your last PAP. If you think it's time for you to have one, you haven't had one in a while, please give us a call. We'd like to get you enrolled if you're interested. There are some phone surveys throughout the study that we give you gift cards for. So there's a little monetary incentive as well, for your time and efforts, and because we're really, the information that our participants provide are helping us, develop better ways to provide greater access for cervical cancer screening for those who need it. And so that's why, it's so important for us to find women who are eligible, so yeah, we care about women's lives and think it's really important that they take control in this way. And that means going, just getting regular screenings, it can be other screenings, right? Like,
yes, all the time.
HIV testing, STI testing. Like if you're sexually active, make sure
we do our mammograms.
Right?
Yeah.
Mammograms.
We we have mammogram parties and stuff like that. So take your sister, your friend. We can do the same thing with cervical cancer.
Right.
Cervical
cancer,
cancer,
colorectal cancer as well.
Yes.
Starting, I think, at age 50. And really, actually, depending on your risk, we don't know what your risk is. So if you're at higher risk or if you're at average risk, talk to your doctor about when you need to get these other life-saving screenings. So I also wanted to talk about, we've been partnering with Grace Church in Raleigh.
Yes.
So this is a community-based church. The pastor is James Davis, and Taj Talk is involved as well, and they're doing this community event on August 25th. It's a Saturday, right before school starts. I think right before like regular school starts.
Yeah, traditional year.
So,
Yep. August 25th, Saturday from 9 to noon at their church. And, you know, my team is going to be there. My Body, My Test. We'll be talking to women about cervical cancer screening. We can, you know, see if they're able to enroll, so we can enroll you into the study if you're eligible. They're also going to have a back to school event. So where they're providing backpacks for kids in need.
Oh, fantastic.
So, and they've done this before. It's been a really huge success. So it's like a family day event. We're calling it Empowering Southeast Raleigh, one family at a time.
I love that.
That's great.
Yeah, so this church does a lot for the community. The pastor is he's such a wonderful, passionate man, and really wants to give back to his community. And so we're gonna have something for the kids, something for the women, and something for the men.
Perfect.
You know?
That's good. Yeah.
So yeah, Saturday, August 25th from 9 to noon at Grace Church in Raleigh. That address is 1401 Boyer Street in Raleigh. So I hope to see you there. Anybody is welcome to come.
So now tell me, once you
Yeah.
do these, when you're going to this church and you get your women, because you're going to get your women, and they become part of the study, then at that point you stay in contact with them.
We do. For a period of time.
For a period of time, there's follow-ups and certain things that they need to do if they in fact want to go to the study, or do you have to do the study and just get the test? Are they together?
So there's a period of when you participate, you know, so you get enrolled, you do your first survey, we get you your first $25 gift card, and then at some point you're offered the appointment for the free pap smear, and then if you go to that, then you'll go to the clinic, and you'll be like a regular patient at Advanced Community Health if you're in Lake County. And then there's a couple of other surveys before, you know, participation ends. So we say about 3 to 6 months is typically how long it takes. But the amount of time is pretty limited. You know, on the phone time, it's probably like an hour. If you go to the clinic, it might be a little bit longer. You know, but you know, I also want to mention that we are doing this in other counties too. We've got Mecklenburg County, which is where Charlotte is.
Oh, okay.
Cumberland County and Sampson County, so that southeast area of North Carolina. We're in the northeastern part of the state. So some of those like smaller rural counties, like Currituck County, Pasquotank, Perquimans.
Which a project like this would be so important for, because especially up there where there aren't larger cities, access again lacks in several areas. So something like this would be life-changing to some of those women.
Yeah, absolutely. And we're really trying to spread the word so that women know about this. And all the clinics that we're working with, they are wonderful partners. They have passionate providers there. We've heard, you know, great things about the women getting care from these practices. So but again, My Body, My Test. I'll give you the number again. It's 1-877-MY-TEST-1. That's 877-698-3781. And you can also visit us on our website at mybodymytest.org.
And you're on Facebook?
We are on Facebook too. Yeah.
Social media?
My Body, My Test. You can find us there.
My Body, My Test on Facebook. Yes. Well, I tell you, this is exciting, and it's always enlightening to help the community. Yeah. It really is enlightening, because when you've been that person, or you know someone, and everybody is either been or know someone. Right. That's just life. Right. And to be able to reach out and help others who are just in need of helping, of getting helped and serving the community is always enlightening. And the place that the clinic you send them, I know of the clinic, and I know of people who have worked there. So I know if they go there and, you know, the test comes out a certain way, they're in good care. Right. And a lot of times you want to know where you're sending me, and are they going to take care of me? Right. And so, if someone finds out that they have an abnormal pap, you know, the clinic is going to work with them, and our project is going to ensure that they can get the necessary follow-up or treatment that's needed. My body, so we are dedicated to ensuring that happens as well. So,
But Jean, thank you so much for allowing us to use your beautiful
Thank
space.
Thank you, ladies, for having me and being at the table.
Yeah, and Kate for
Being at the
you
table, yes, Kate.
sharing your personal experience. I
Yes.
know that can be hard, and
Okay.
but it's so important for other women to hear about it so that they can make a decision themselves. Like, hey,
Absolutely.
okay,
Yes.
I need to do this.
Right.
For my own health, especially if you're a mother and it's been a while and you have a child that you're taking care of, that child needs you to be in good health.
Absolutely.
So same thing with someone, if you're taking care of your mother or your grandmother, they need you
Yes,
to be in good
because
health.
that's where we are now in society. We're taking
Right.
care of our parents.
Yeah.
Right.
You know,
Yes.
we're taking, which is interesting because families have always done that, but it's never been us. It was our moms taking care of our grandmoms
Yeah.
and the great aunts, but now we're
Correct.
taking
It
care
is
of our
gonna be it,
parents.
yeah.
So
Absolutely.
we got to be strong for the family and for mom and dad.
Yep. You're right.
We've got to be healthy.
Yeah,
We've got to be healthy.
that's important. Well, thanks so much.
Thank you. Well, it has
Yes.
been a pleasure. It has been an absolute pleasure. Well, once again, we thank you for tuning in for this candid conversation. Just thank Kate for her transparency. Of course, Sarah for her knowledge. Just please take advantage of the resources that have been given to you today. And once again, thank you for tuning in with Taj Talk on the YouTube channel. Stay tuned for other things that we'll be doing. We're here to serve you. Have a great day.